My name is Chris Masiello, and I'm 29 years old. At 18 months, I was diagnosed with hyper IgE. Over the past few years, it's really kind of come to a head, and right now it's got me in a pretty tough spot.
I really would hate to think about what my life would be like without VNA. It's life-changing for us.
It's been an incredible year. It's the 110th anniversary of VNA Health Group. We're going as strong as ever. We're doing more things for more people in more places. I think Geraldine Thompson would be proud of the work that's being done.
Our patients need us more than ever. Our social workers, our therapists, our nurses, our aides, they need that level of compassion and expertise to help guide them and keep them healthy at home and bring them back to a full life.
If anyone was doubting the relevance of VNA Health Group does, the pandemic has sure been a lesson in how important home and community outreach is for solving these serious public health issues.
It's just amazing. Over 100,000 vaccinations delivered, first shot, second shot, booster shots all together. We've expanded a number of our core programs to our patients and our community members who need them most.
In 2020, the word was really to move seamlessly back into in-person events. It's all about connections. It's all about establishing trust. The highlight of what we've really tried to do is this integration between the Children and Family Health Institute, our 24+ programs, serves 57,000 people in 2021, our community health centers.
We've served nearly 15,000 patients. We're on track for 50,000 office visits, providing primary care medicine, dental services, behavioral health, women's health to those in our community who need it most. If this past couple of years weren't challenging enough, the VNA Health Group have been challenged yet again by those in government who are responsible for reimbursing the organization for its care and vital services in the community.
One of the things that I'm proud about, when home care nationally is having some type of challenge or needs to communicate better with policymakers, they call on VNA Health Group.
We've been working very, very hard to make sure that we educate and advocate with all of our policymakers.
It's important for our organization, but I'd say for a country with an aging population where more of the people would like to be cared for in their homes, in their independent settings as long as possible, we need to do better with these policies. This past year has been monumental in terms of expanding our partnerships.
We can't do this by ourselves. We need dedicated partners that are right along with us and have specialties and expertise that we can combine with our community access, take it to the next level of the care that we're rendering.
Visiting Nurse Association of Ohio has been the flag bearer for home and community care in the Northeast Ohio market for over 120 years. That organization established a partnership with Metro Health. We're committed to working with them, strengthening their overall continuum of care through the partnership. This year, we launched the Parker Advanced Care Institute. This is a partnership with VNA Health Group and Parker Life, one of the leading aging services organizations in the country.
To meet the needs of New Jersey's residents who are facing serious life-limiting illnesses, that are frail, that need the medical community to come to them.
We brought our minds and our resources together to expand visiting physician services. So these are the home visiting docs.
It's also afforded us some real opportunities to grow the palliative program. People became more aware, providers became more aware of what the palliative team could bring to the bedside.
We're not satisfied that we should just keep doing everything the way we did in the past, because we've got these great opportunities with new technologies.
But we used to have some of our wound expert nurses driving around. They'd be able to see maybe 2 or 3 patients a day. Now they have upwards of 20 video conversations. They're reviewing photographic documentation and providing consults. And so we surveil a population of over 1,800 wounds daily. We've got over 200 clinicians now live on our voice-to-text platform, tap the microphone and able to speak their notes. It's been life-changing. It's reducing their documentation time by hours a week. Having the opportunity to really create the roadmap together with what the actual problems our clinicians are experiencing or the challenges that they run into every day, and be able to help craft solutions with them that'll be impactful right out of the gate is just a tremendous opportunity.
The VNA is a nonprofit charitable organization that can accept charitable contributions in support of its mission.
The VNA relies on this support to sustain underfunded programs such as the Children and Family Health Institute and the VNAHG Community Health Centers.
Charitable contributions, regardless of the size, make a huge difference and a huge impact on the organization, and we're grateful for all of them.
The VNA in 2021 saw an enormous outpouring of support from the community. Over $7 million was contributed in 2021 from the community. An incredible amount of support. And year to date, in 2022, we are seeing an unprecedented level of support by year end. This is truly amazing. This includes an extraordinary bequest of $4 million for hospice. We are so grateful for the generosity of 2 anonymous donors who have made 7-figure gift commitments, one of $1 million and another of $5 million, which includes a $2.5 million challenge matching gift to our Moving Healthcare Forward Together campaign. We were so excited in 2021 to have our public events back in person. This includes our Golf Classic and Hospice Pro-Am Golf outing. And in 2022, we saw the return of our very popular beach ball, raising nearly $500,000 and attracting over 600 supporters of the VNA. The beach ball is one of the best events in Monmouth County. Our other events this year include Rocking by the River to benefit SEED, Emerging Leadership Board Bowling in the Park, and the Holiday Bash to benefit hospice. Other events include generous 7-figure grant from Parker Health in support of the Advanced Care Institute in 2021, as well as continued support from the Jules Plangier Foundation and the Grunin Foundation last year and this year. A generous gift in 2021 from our beloved trustee, Frank Vigilante, to establish the Diane Vigilante Memorial Hospice Education Fund. Sadly, Frank passed away early this year, and his giving continued with a generous bequest from his estate. In 2021, and as the year closes, we are seeing an outpouring of support for our Seasons of Hope Adopt a Family program to provide gifts for over 800 needy VNA patients, as well as Holiday Lights of Life mailing for hospice. We are so grateful to all the individuals, foundations, and corporations who have supported the VNA so generously this year.
As we've looked at our history, we've looked at what's needed in the community, and we've zeroed in. And this is our Moving Healthcare Forward campaign. We can make a bigger difference if we focus on aging with dignity, on advancing health equity, on making an impact in behavioral health and workforce creation. We've actually set a goal to raise $25 million by 2025. If you're excited as I am about the work that we're trying to do, please join us in this Moving Healthcare Forward Together campaign.
I love meeting the staff. They come in, even with the mask, you could tell through their eyes they're smiling. They love their patients. It's been extremely inspiring, and I couldn't be prouder.
I think the vision forward is what separates this organization and what we're doing from other people in the same field.
We have dedicated, passionate people who don't really just view this as a job. They view it as a calling. Together we will be stronger, and together we will move healthcare forward.
Our people are committed to waking up every day and solving the harder problems, to steer people, to steer families to a better life. That's why I'm proud, is because of those people doing the work in the community that's backing them up. That's a great thing to be a part of.
You don't know until you unfortunately need them. Then when they come into your home and you see what they can do for your family member, for your loved one, it's life-changing for us. So without them, we would be lost.
Thank you for always being so helpful, always being there for us. I can't really express in words how grateful I am for your support.
VNAHG's Children and Family Health Institute, VNAHG Community Health Centers, and various community partners established the first ever doula collaborative in Monmouth County. As of June 2022, over 10 multicultural community doulas have been trained to serve low-income minority women in Monmouth County. VNAHG's Children and Family Health Institute school-based nurse practitioner services increased, with a focus on students' mental health concerns due to COVID-19, working alongside school staff to connect students to counseling and other behavioral resources. VNA's Harm Reduction Center provided hundreds of rapid HIV tests, identifying new HIV-positive individuals and referring all into treatment. HRC had a nearly 90% increase in clients served, with more than 70,000 syringes and hundreds of Narcan kits distributed, connecting more patients into drug treatment programs than ever before. VNAHG's Cancer Education and Early Detection Program continued to grow in 2021, serving more than 2,500 patients while enrolling more than 1,200 new patients to the program and continuing to provide thousands of breast cancer and cervical cancer screening. The Children and Family Health Institute provided tens of thousands of COVID-19 tests in Middlesex, Union, and Monmouth counties, among others. Participation increased in the Women, Infants, and Children program by nearly 8%. Cleveland Clinic Florida visiting nurses developed a partnership with Medically Home for Cleveland Clinic Florida's hospital program. It was selected to partner with the Palm Beach County ACO, one of the first and largest ACOs in the nation. The VNA was also selected to be a performance partner with Holy Cross Health System and built a relationship with Hospital for Special Surgery Florida to serve orthopedic patients. VNA of Ohio leveraged its partnership with Metro Health System, partnering to deliver nursing care for Metro Health's first ever hospital in the home. It also secured a Three Arches Foundation grant for nearly $120,000, using these funds to address the mental health needs of underserved populations. VNA of Ohio raised a total of nearly $600,000 on a $550,000 budget. Visiting physician services saw 5,000 patients in 2021, totaling over 30,000 visits. VPS also transitioned from CPC Plus to Primary Care First, moving closer to value-based care. VNA Health Group celebrated the 5th anniversary of the VNA Palliative Care Program at Community Medical Center. Thanks to the support of the CMC and the Grunin Foundation, the palliative program has provided more than 10,000 visits in the last 4 years. In collaboration with RWJ Barnabas, VNA Health Group created an end-of-life lecture series for continuing medical education, which included videos by VNA palliative physicians on palliative and hospice care, as well as end-of-life conversations. In 2021, all of VNA Health Group's home health services throughout New Jersey, Ohio, and Florida conducted nearly 950,000 visits and served more than 40,000 patients. VNA provided compassionate end-of-life care to thousands of hospice patients, performing more than 170,000 hospice visits in 2021. The VNA received thousands of gifts from 2,000 donors in 2021, with investment income totaling nearly $2 million, for an overall total of nearly $9 million. Nearly $2 million raised for the COVID vaccine Vital and Needed by All initiative. Special events raised nearly $400,000 for the organization. VNAHG Community Health Center received $200,000 in grants from local foundations. Contributions for the RWJB, RWJ, and Englewood joint ventures totaled nearly $300,000 from bequests and memorial tribute gifts. Undesignated donations totaled more than $300,000. A Jeep car raffle netted over $65,000. Public grants funding CFHI programs totaled more than $14 million. Lastly, VNA's employees showed their generosity and compassion by giving $20,000 of their own money for the We Care Patient and Employee Emergency Fund.